Yesterday we saw about basics about cholinergic activities, how acetylcholine is biosynthesized and how it is released. What do you mean by uptake? What are various agents which can affect these various processes? Then what about cholinesterase enzyme and how it plays role? How we can increase acetylcholine by giving the agents which can cause uh, cholinesterase inhibition, and because of that we can increase the acetylcholine level in the synapse. So there are these were indirectly acting, those which are acting on acetylcholinesterase enzyme. The others which we are seeing, they are the direct acting. We'll start with them. There are many like bethanechol, then methacholine. These are the agents which are there. Carbachol is one of the drug, and they are used in various purposes. Example, bethanechol is used for stimulation of a tonic bladder, the urinary bladder which is not having a proper tone, which is not contracting properly. Then in non-obstructive urinary retention, it is to treat it. It is used in neurogenic atony. In megacolon, it is used. While the carbachol is used in ophthalmology, I told you that you will encounter the disease glaucoma and all. In that, you will able to see these agents. So other directly acting anticholinergic agents are, example of this is a pilocarpine, is a tertiary nitrogen. It has good absorption. It can penetrate blood-brain barrier, and it is available for various purposes, including ophthalmologic purposes. It is causing increase in the secretion. So all the agent which increases the secretion, they are called as a secretagogues. So whenever it is given, it causes increase in the sweat, tears, saliva. It is obtained from the jaborandi plant, and that is jaborandi plant is showing this secretagogue effect. It can be used in the treatment of Sjogren syndrome, that is characterized by dry mouth and lack of tears. So that increases because of the cholinergic activity. It increases the secretions. It is also used in the treatment of glaucoma. So this is the effect of pilocarpine in eye, and by that virtue it is used in the treatment of glaucoma because it increases the drainage. Basically, glaucoma is a disease which is because of the obstruction or increase in the flow of the aqueous humor, which is there inside the eye. And this aqueous humor builds the pressure that is caused as increase in the intraocular pressure. So which we can see the mechanism how it is doing. So it causes the contraction of longitudinal fibers of the ciliary muscles, and because of that it causes opening of the trabecular pores. So there are the trabecular pores through which the aqueous humor is drained, and because of the draining of increase in the drainage of aqueous humor, the pressure is decreasing. So this is how it is working. So it is used in xerostomia, that is dry mouth. It is drug of choice in emergency glaucoma and applied as eye drop. Adverse effects are profuse sweating, salivation, bronchoconstriction, diarrhea, CNS effects. These are the adverse effects. Again, all effect I'll suggest you to remember. Basically, if we know that this is the drug where it is acting, it is a cholinergic drug. Since it is a cholinergic drug, it is going to act on various cholinergic receptors. Now, because of cholinergic activity, all these effects we have seen earlier, that will be seen as we have seen. It increases secretion, so profuse sweating, hypotension, salivation, bronchoconstriction, diarrhea, CNS effects. All these will be seen because these all are the effects of cholinergic activation, or whenever any drug which binds to the cholinergic neuron. Then another drug is aceclidinum. This is a synthetic preparation. It is administered by subcutaneous intramuscular or topical use like eye drops. It is not as toxic as or lesser adverse effect comparatively. It does not penetrate CNS, so no CNS effects can be seen. It is particularly muscarinic cholinomimetic, that is, it is having more action on muscarinic effect. It is used for the treatment of atonia of the intestine and urinary bladder. Atonia, please just remember this word. Means loss. Tonia means tone. Tone means partial contraction. So there is a loss of uh, partial tone of intestine or urinary bladder. Then it is used, and same it is used in a glaucoma, same as the previous one, pilocarpine mechanism. Then they are also used in the treatment of mushroom poisoning. So these are the this mushroom is what? Mushroom is containing muscarine. So all the muscarinic effect we will be able to see. What are these muscarinic effects? Meiosis, hypersalivation, excessive sweating, lacrimation, cold wet skin, bradycardia, polyuria, diarrhea, convulsions. These all are because of uh, this type of mushroom, which is having muscarine as their uh, chief content. So it will show all the muscarinic activity as we have seen earlier. Atropine is the drug which causes or which will be used to, because atropine is a blocker of muscarinic receptor. It can block all type of muscarinic receptor. So atropine will be the treatment uh, for the this poisoning by the mushroom. Okay, very simple. You have to remember is when there is a atropine like drugs, particular that is belladonna. If it is a poisoning because of belladonna, you have to use pilocarpine or such agents because they are agonist. Atropine has blocked the site, and vice versa. When there is a mushroom poisoning, we are using atropine as a one of the important treatment. So that this you have to remember. Then agents which are acting on N receptors, so they stimulate the N receptors and at various places. Example is zona carotis, and they initiate a reflex in increase in the activity of respiratory and vasomotor centrate, resulting into the short stimulation of breathing and elevation of blood pressure. They also stimulate the N type of cholinereceptors in the adrenal medulla. They increase the secretion of epinephrine, and because of that, there is a vasoconstriction and elevation of blood pressure. Example is, or the common is nicotine is a tobacco alkaloid with a dose dependent action on the N type of cholinereceptors. The effects are manifested into tobacco smoking. Nicotine causes dependence that leads to abuse of tobacco and results into development of cardiovascular and lung problems. What are the effects it is having? It causes increase in the emesis due to action on the chemoreceptor trigger zone of the medulla oblongata. Then it causes dependence, which makes hard it to quit. We have seen the dependence, physical and psychological, earlier when we were seeing the factors modifying drug response. Then respiratory depression it causes due to action on medulla oblongata. It can cause tremors and convulsions, particularly at higher doses because of the CNS delusion or excitatory effect. We have seen as a EPSP earlier. Then what will happen if they are stimulating peripheral nuclear receptors or NN receptors, where they are NN are present on in periphery, where they are present in the ganglia. So what will be the effect if ganglia is stimulated? Then because of ganglia, the postganglionic neuron is also stimulated. Okay, so because of this, uh, it causes increase in the GI motility, that is nausea, diarrhea, vomiting. It causes stimulation of parasympathetic ganglia. There can be increase in the heart rate, increase in blood pressure because stimulation of sympathetic ganglia. Because in ganglia it is common. Acetylcholine is there for both ganglia. So whenever it is stimulating, it will cause stimulation of both cholinergic as well as adrenergic system, or sympathetic as well as parasympathetic system. So therefore, any drug which is able to act on NN receptor as an agonist will able to cause increase in the sympathetic as well as parasympathetic activity. Very simple about it. And any drug which is able to block this receptor, NN receptor of the ganglia in the periphery, then it will block all the cholinergic or parasympathetic and the sympathetic, because ganglion is common. For that, ganglion is having acetylcholinergic receptors, and that is common for both. It is common for sympathetic, it is common for parasympathetic. I hope it's clear understanding. So the drugs in that are Lobelin is alkaloid. It is administered intravenously and acts during 3 to 4 minutes. It stimulates N cholinereceptors, but in CNS, it is used for emergency help in the respiratory arrest. So there are certain drugs in CNS also, we shall say, and they can cause the respiratory depression. If the respiratory depression is very severe, then person can die because of the respiratory failure. So these are the use in respiratory arrest. Aspexia of neuron. These are newborns, and it is used to treat tobacco abuse in the form of combined tablets. So it is not used for the collapse due to its ability to provoke transitory decrease in blood pressure, because it causes stimulation of the vagus center. So Lobelin is used, it is one of the stimulant of the respiratory because of its nicotinic action. Okay. Then next is cytitonin. It is the name of cytizine solution. It is administered intravenously. The action is 3 to 4, 5 minutes. It stimulates N cholinereceptor, and because of that, it can reflexly stimulate respiration and it increases the blood pressure. Used for emergency help in respiratory arrest and collapse, and it is ingredient of combined tablet against tobacco use. So these are the agents which are added into the preparation for the de-addiction of nicotine. If you will search, you will find that there are nicotine patches are available. Some chewing gums are available so that person can quit smoking. Because in smoking, along with nicotine, smoking people take for nicotine only because nicotine has caused addiction. But along with nicotine, the smoke and the tar, it goes and it causes damage to lung. So what is done is with these chewing gums or this all preparation, this small quantity of nicotine and other such agents are being given, so that slowly nicotine can be the doses of the nicotine can be reduced. Initially, person will feel same activity for some time, and slowly then it can be withdrawn. So like that, that is what called as a smoking cessation program. Smoking cessation program in which the nicotine patches and other such medications are used so that person can quit nicotine. So it is ingredient of this combined tablet against tobacco abuse. Now, what are the indirectly acting cholinergic agonists? We have already seen them. That these are the agent which are able to block the cholinesterase enzyme. If cholinesterase is blocked, that means cholinesterase will not able to metabolize acetylcholine. If the acetylcholine is not metabolized, then it will remain in the synapse for longer time. That means its action will be increasing. So same acetylcholine will act for longer time, and therefore more actions can be seen. So they are not acting on acetylcholine receptor. They are not doing any other thing, but they just prevent the metabolism of acetylcholine. Therefore, we call them as a indirectly acting cholinergic agonist. So they are of two type: reversible and irreversible. There are various examples of reversible, that is atrophonium, neostigmine, physostigmine, rivastigmine, galantamine, etc. Irreversible are the organophosphorus compounds whatsoever they are available as insecticide pesticides in market. Most of these are the organophosphorus compounds, and they have similar mechanism in insects or pest. So these are example of these are ecothiopate, organophosphates, then armenium. Some of these are very very toxic gases like sarin, tabun, etc. These are the gases which are used to kill many people, or we call it as a chemical warfare agents are there. So these are all agents which are acting as a cholinergic agonist. How they are acting as a cholinergic agonist? As I told you, they are causing the inhibition of acetylcholine esterase enzyme. Because of inhibition of acetylcholine esterase enzyme, they will not allow acetylcholine to be metabolized, and that will remain over there, and it will cause action for long period of time. So how this is happening? These are the sites are there. There are two important sites are there on the enzyme. That is, one is called as an anionic site, and other is called as a esteric site. So on esteric site, the ester binds while the in this one the while on this anionic site, the N group will bind, and it will cause breaking it down into acetic acid and choline structure. So this is happening, and if this is blocked, if it is reversible, then it will do it for a small time. While if it is irreversible, they will permanently bond, and it will permanently block the sites. Just a minute. This will permanently block the sites, and these sites, if the permanently blocked, then the drug cannot be, or yeah, the enzyme that will result into toxicity, because too much acetylcholine will be continuously present in the synapse. So when we go for the next, that is physostigmine, it is from calabirbrin. It has got a tertiary nitrogen, good absorption. It can penetrate blood-brain barrier. So you can see the CNS actions also. So same indications it will have. Whatsoever there for acetylcholinergic agents, we have seen pilocarpine and other agents. Same action. It is used in atony of intestine, atony of bladder, in glaucoma, and for the treatment of overdose of atropine or antipsychotic or antidepressants, which are having anticholinergic effect. So in the treatment of anticholinergic toxicity, we can use this physostigmine. The side effects are convulsions, bradycardia, paralysis of skeletal muscles. So these are the important adverse effect it is having. Why it will be there? Because it can cross blood-brain barrier is one thing. If it crosses blood-brain barrier, means in central nervous system, in brain, whatsoever acetylcholine is released. We have seen at many places acetylcholine is released. So that acetylcholine will not be metabolized. If it is not there, then it will remain in synapse for longer period of time. And if it is there for a longer period of time, or if its action is increased, then it will cause all that CNS stimulant effects and reflex actions. Then next in that is neostigmine. It is quaternary nitrogen. It is poorly absorbed. It does not penetrate blood-brain barrier, so you will not able to see the side effects which are related to blood-brain barrier or because of the crossing into brain. So it is used uh, in the paralysis. Then in the treatment of myasthenia gravis, we shall see myasthenia gravis separately also as an antidote of neuromuscular blocker, that is tubocurarine, where we have seen earlier, that is it is a NM receptor blocker, and we call it as a skeletal muscle relaxant drug because of non-depolarizing type. What are the side effects? Salivation, flushing, decrease in BP, abdominal pain, diarrhea, bronchospasm. You will notice one adverse effect is not there, that is excitation or CNS stimulation. Why it is not there? Because it is not reaching to blood brain, or it is not crossing blood brain barrier. So only whatsoever effects are there, this you can see only peripheral side effects. The next is what are the other effect it can cause is bronchial asthma, intestinal inflammation, bladder obstruction, and peritonitis. These are the problem, or in this it should not be used. These are the contraindicated actually. So galantamine is the alkaloid from Galanthus oronovi. It can be administered subcutaneously or intramuscularly. It penetrates to CNS. It has got a reversible anticholinesterase action. It is used in the treatment of paralysis, neuritis, and early stages of Alzheimer's disease and other neurological diseases. Now, if you remember, we have seen earlier that acetylcholine plays important role in cognition and memory functions in CNS. So whenever the disease like Alzheimer is there, where there is a loss of cognition or loss of memory, then dementia as we call it. So in that cases, in dementias, we are using the drug which will increase the acetylcholine concentration. We know that acetylcholine cannot be given because it cannot be crossing, even it will not even reaching to blood properly, so it will not able to cross blood brain barrier, it will be immediately metabolized. So we should have some agents which can cause acetylcholine like action and able to cross blood brain barrier. So whatsoever drugs which can cross blood brain barrier, and they are indirectly cholinergic agent because they prevent the metabolism by acetylcholinesterase, that is therefore they are used. Peritonitis is what? Peritoneum, you know, inflammation to peritoneum is a peritonitis. Then next is hydrophonium, is a quaternary nitrogen. It is poor absorption, it is not penetrating blood brain barrier, and the duration is just 10 to 20 minutes. And it has got a very very important use of diagnosis of the disease like Parkinsonism. Okay, there are two similar conditions. In one there is a decrease in acetylcholine, and in another there is an increase in acetylcholine. So there is a one condition, sorry, there are two conditions. One is myasthenia gravis, I'm sorry, not Parkinsonism. There is a myasthenia gravis where there is a decrease in the acetylcholine release, and there is another disease that is called as a Huntington's chorea. You can search this, what these are, Huntington's chorea. So to diagnose this, myasthenia gravis is because of the decrease in the acetylcholine, while Huntington's chorea is because of increase in the acetylcholine release. Okay, in myasthenia gravis muscles are weak, while in that the in Huntington's chorea the muscle has become rigid, and because of that, in myasthenia, because of the weakness of muscle or flaccidity in the muscle, movements are difficult. In other case, it is because of the hardness of the muscles, because of the contraction or increase in the tone of muscle, the movements are difficult. Now if this hydrophonium is given, what hydrophonium will do? It will increase or decrease acetylcholine? What hydrophonium will do? It will increase the acetylcholine concentration or decrease the acetylcholine concentration in the synapse. Why increase? Why it should increase? Very good. It block acetylcholinesterase, and because of that, it will cause. Okay. Now thing is very good, Chakradhar. So it is, if the case is myasthenia gravis, in which there is a decrease in the acetylcholine, what it will do? It will benefit or it will cause harm? It will be beneficial for myasthenia gravis, or it should be harmful? Benefits. And what will happen to Huntington's chorea? Okay. So what is benefit of this is this duration is just 10 to 20 minutes. That means the person who is having Huntington's chorea will have harmful effects for how much time? Only 10 to 20 minutes. But that will give you indication that yes, the person has got Huntington's chorea and it is not the myasthenia gravis. And if it is showing benefits in the person, then we can say that person was having myasthenia gravis. Okay, so in just 10 to 20 minutes we can get the diagnosis, and then one can go for treatment of longer duration. This much is okay, understood? So why this very small otherwise it has no important uses. So it is used in the diagnosis of myasthenia gravis, and it is antidote of neuromuscular blocker. So whenever we have to use it for very short duration, edrophonium is used. Then next is rivastigmine, is good absorption. It penetrates blood-brain barrier, and it is therefore one of the very very important drug in Alzheimer's and Parkinsonism. You will find that these are the drugs which are used in these diseases. Rivastigmine. Then next is already I told you about this. That is what is rivastigmine. Ecothiopate is organophosphorus compound. I told you all these organophosphorus compound, they are irreversible blocking, and if they are irreversible blocking, then see this organophosphorus, the P is there. So just a minute. So this ecothiopate, you can see it is a phosphate organophosphorate compound. So this is having irreversible type. Suppose it is given, it will act for very long period of time or almost lifelong time. Okay. So the organophosphorus, they are causing poisoning. Now, but this is the agent ecothiopate that is having a therapeutic use, that is only in glaucoma, because in eye there is a rapid changes are taking place, and therefore what's your duration of action, long duration of action we can achieve because of ecothiopate, but it will not affect uh, lifelong as it affects all body. So this organophosphorus can be used for the glaucoma, and that will be acting for a longer period of time. Very small concentration. You can see it is 0.125%, means even less than 0.2% we are using. Okay. So this is how these organophosphorus are having some of the therapeutic uses. So these organophosphorates are compounds are there. They are useful. They are used in agriculture and other places as killing mosquitoes, insects, other pests in various farms as a pesticides in particularly cotton and other vegetable farming agriculture. They are present. So these are the organophosphates, and they are showing toxicity. What will be the toxic effect of this if it goes? This is all acetylcholine effects. Increase in salivation, increase in lacrimation, increase in urination, increase in defecation, increase in gastrointestinal motility, increase in the emesis, vomiting will be there, meiosis will be there. Meiosis means pinpoint people. So people made it as a abbreviation like slurred gem, that it will cause sludge. These are all the adverse effect we can see because of the increase in the acetylcholine secretion for long period of time. So these are the organophosphorus compounds. If they are used, they are very popularly consumed for the homicidal or suicidal, or even sometime for the killing purpose, and therefore the adverse effects, the effects immediately, or these are the diagnostic feature. If the person is saliving very profusely, lacrimation is there, urination is there, emesis is there, and all froth is there, because the air which is passing through all these secretions, it will produce froth. So froth is coming out of the mouth because lacrimation gas, all secretions are there, and through which the air is passing. So the person can die because of many reasons, because these secretions can go into respiratory tract. There it can cause a problem, obstruction, respiratory failure, and many other effects. It will cause brain effect. Already we have seen many. So there are, because of many effects, the person you die because it is consumed in high doses. Now the biggest problem in that case is what is the acetylcholinesterase enzyme is blocked irreversibly. So if it is irreversibly blocked, then the biggest problem is how it has to be recovered if the person is saved. So there are the drugs which are called as a oximes, and these oximes, they causes reactivation of acetylcholinesterase. So they will act with this organophosphorus compound and the acetylcholinesterase complex, which we have seen, and they will have more binding strength than acetylcholinesterase receptor or enzyme and the organophosphorus. So what organophosphorus will do is, organophosphorus will do leave the enzyme and will bind with this prolydoxime or these oximes. Okay, so these are the oximes. They are very important in the treatment of organophosphorus poisoning, because they are called as a reactivator of acetylcholinesterase in these enzymes. So this is what activation is done. But whatsoever acetylcholine which is secreted already is there. For that we need to give agents which will block all the muscarinic receptors. So we have the agent, the example atropine, which is having non-selective anti-muscarinic, means it will acting on all muscarinic receptor M1, M2, M3, M4, M5. So since it is acting on all muscarinic type of receptor, the atropine is the best choice in that condition, and therefore atropine is simultaneously used. The other one treatment simultaneously is the diazepam. So these are all the agents which are directly and indirectly acting cholinergic agents. Okay. Uh, there are many such agents. As I told you, please go through the book, make the table of this, what are various drugs and for what purpose they are used, and how they are effective, how they are useful in various conditions. Some of the conditions we shall be seeing later. Example, myasthenia we shall be studying separately. Then Parkinsonism we shall be studying separately. Then in CNS we shall be studying Alzheimer's. So at that time, this basic will be helping you. Will not go for more details at that time because you know about it. Okay. So then there are drugs, we call them as a skeletal muscle relaxants. Again, this is the basic principle. This is how the drugs are acting on nicotinic NM receptors. So you know about NM receptors. Okay, at that time I just want that you should go through whole process of skeletal muscle contraction, and what do you mean by refractory period? What do you mean by muscle tone? You write down these points. These points will be important when we discuss the next portion. Okay. So at present, I think we have gone through the all cholinergic agents. I repeat, please read it thoroughly, read it through book, and read each and every type of drug. Basically, they have all similar actions. The differences are pharmacokinetics, and only because of one or other drug is not reaching to one or other type of tissue. So, example, some are crossing blood-brain barrier, some are not crossing blood-brain barrier. So these are only the big differences. So I repeat this, you go through it, you go through all the drugs in pharmacology, all the cholinergic, directly, indirectly acting. Okay, you go through organophosphorus poisoning, and then we shall discuss about all other details. We already discussed all the signs and symptoms about it. Now, cholinergic blockers or cholinolytics, parasympatholytics, the words we have already used. We can have several words for that. Anticholinergic, cholinergic blockers, cholinoblockers, parasympatholytic, cholinolytic, these are all having same meaning, that is they are acting against acetylcholine, or they are acting as antagonist of acetylcholine. So we call them as a blockers or cholinolytics or anticholinergics. Okay, so these terms are same, just keep it in mind. uh, Many places one or other term is used, so you should not get confused. Some places anticholinergic use, some places they use parasympathetics, some places you will find cholinergic, some places cholinoblockers. Okay, so like that it will be there. What are the agents? We know there are two basic receptors we have, muscarinic and nicotinic. The agents which are acting on muscarinic receptors, we call them as a muscarinic cholinoblockers or muscarinic antagonist. In that, if we classify, then we have natural agents which are from plant sources like atropine, hyoscine, scopolamine, then platyphylline. Then there are some of the semi-synthetic and synthetic derivatives. That means from plant whatsoever compounds are isolated, their structure is slightly modified. Example of these are homatropine, propanthelin, then methacinum, ipratropium bromide, then cyclopentolate, pyranazepine. These are various agents. They are either semi-synthetic or synthetic. Semi means partially from plant and it is slightly modified. Synthetic means totally synthetic. There is no relation with the plant. Then in N receptor, we have got two types of receptors. One are NN and NM type of receptor. The drug which are acting on NN receptor, we call them as a ganglionic blocking drug. These are hexamethonium, benzhexonium, hydrogonium, mecamylamine, pempidine tosylate, trimethaphan. These all are the ganglionic blocker drugs. Just now we have seen a few slides before. We have used ganglionic stimulants. Okay, these ganglionic stimulants means it will cause increase in action of both sympathetic and parasympathetic. So if we use blockers in that, if we use ganglionic blockers, so it will cause reduction in both activity, sympathetic as well as parasympathetic activity. And since it can able to act on both, or it will cause decrease in both activity, sympathetic, parasympathetic, it will play a very big impact on homeostatic mechanism, because ANS plays very very important role in all homeostasis maintenance. So this ganglionic blocker can affect or and therefore the adverse effects can be many, and therefore they are not much of choice. Earlier they were there. When we shall study the antihypertensive drugs, at that time we'll see the classification. One of the classification is ganglionic blocker drug, but they are not uh, prescribed nowadays because of the harmful effects they are having. Okay, then other class is there which are acting on NM receptor, that is neuromuscular blockers. So we have got two types of agents in that. Again, a separate chapter we have got for that. That is neuromuscular blocking agents, or skeletal muscle relaxants we call them. So non-depolarizing and depolarizing. You know these words. What do you mean by polarizing or depolarizing and non-depolarizing? Depolarizing means which causes contraction. Which agents will cause contraction, which will cause depolarization of skeletal muscle? Those which are having acetylcholine like activity, because acetylcholine acts on skeletal muscle receptor, that is NM receptor. Because of that, it opens ion channels. Because of opening of ion channels, it causes passage of positive ions, it causes changes in the voltage. Because of that, calcium ions, they come into cytoplasm and they play a role in a contraction. That is what you have seen as a physiology of skeletal muscle. Okay, so this is what they are causing depolarization. Then why they are causing blocking? If it remains longer time, then that's what I was asking to study you. That is, you study about refractory period, you study about muscle tone. Okay, so if you understand about this, then it will become easy for you to understand. Depolarizing also causes decrease in the skeletal muscle movements, or they causes problems in the skeletal muscles activity, or they restrict it. And non-depolarizing are opposite to that. They will cause blocking of acetylcholine NM receptor. and because of blocking of NM receptor, these drugs will cause the less action of acetylcholine, and because of that, less calcium means less contraction. So whatsoever partial contraction is there, that will not also be there. So this is what we call it as a neuromuscular blocker. So these are variety of agents we are having. We are having muscarinic blockers, we are having nicotinic blockers, nicotinic on ganglion, nicotinic on neuromuscular. So how they block, just like the acetyl, this is a schematic representation that it mimics, because we know antagonists are what? They have affinity but no intrinsic activity. So atropine, scopolamine, they have no intrinsic activity. They occupy the acetylcholine receptor and they will not allow acetylcholine to act on the receptor. So this is how the mechanism is there. What are the effects they are having? Now, again, it is very easy. You know about the effects of acetylcholine. So first, you understand all the prototypic effects. What are the physiologic effect of acetylcholine on the body at various places? Now, if it is agonist, example pilocarpine, then methacholine, etc., then what will be the action? If it is a blocker, then these actions will not be there. That means these are the actions. Okay. So what will be the action? We have seen that we have used it in glaucoma. Why we have used? Because it was reducing intraocular pressure. Now this will causes the increase in the intraocular pressures. We have seen that the cholinergic drug, they causes meiosis. We have seen one of the adverse effect or one of the toxic sign of the organophosphorus because of more acetylcholine. It was a meiosis, that is pupil size reduced. Now, if these drugs are there, which are blocking acetylcholine, they will produce mydriasis. Then we have seen spasm of accommodation, that long vision will be problem. Here it will be inability to focus for near vision. Then we have seen there were so many secretions, saliva, etc. Then here we'll see that it is causing xerostomia. That is no salivary secretion, or dryness of mouth is one of the very, very common side effects these agents will have. Then next is on bronchi. It was causing bronchoconstriction. Here it is causing bronchodilation and secretion. So that means this is one of the place where it can be used where you don't want to have salivary secretion. So that is what one use it can have. Then if you don't, in case of bronchial asthma, you need to have bronchial dilatation. So for that, it is bronchodilator effect it is having. So that is the use these drugs are having. They causes increase in the heart rate, because acetylcholine causes decrease in heart rate, or it causes bradycardia. So they block the bradycardia effect of acetylcholine, and therefore they causes uh, increase in the heart rate. See, mind well, very, very important thing to understand. They don't have their own action. Acetylcholine, which is naturally secreted in body, either in lesser or more amount, depending on the situation. So whatsoever acetylcholine is secreted, they are not allowing it to bind, and if they are not allowing to bind, that means they are opposing the action of uh, acetylcholine. So they don't have any intrinsic activity, I repeat. So they are very purely antagonist. So they are antagonists, so there is no intrinsic activity. They are not doing any of these actions. These actions are happening because of the blocking of acetylcholine. I hope you are understanding this concept. It's very, very important to understand. They don't have their own use. Okay. If acetylcholine is absent by chance, then they will not show any effect. Why? Because their job is to block acetylcholine. So if acetylcholine itself is not there, you will not able to see any of these effects. This is very clear, understood? Then next is effect on GIT. It causes in decrease in secretion, decrease in peristalsis. It causes increase in the sphincter tone. It decreases the bladder detrusor and sphincter tone. It increases sphincter tone, and muscle contraction of detrusor decreases. So where they are used? What are the clinical use for blocking in case of arrhythmias? Uh, when there is a AV block, that is, there is a decrease in AV conduction, we can use atropine to increase the AV conduction when heart rate has reduced too much. Then in colic or abdominal cramp, we can use atropine or platyphyrin. When there is too much urinary frequency, we have a drug oxybutynin which is acting on that as a pre-anesthetic medication, because during anesthesia salivary secretion increases, and if the person is anesthetized, if this salivary secretions reaches to, or it goes into respiratory tract, then it can cause obstruction and can cause problem. So this is in that cases we have got these agents as a pre-anesthetic medication. Example is again atropine, hyoscine. Okay. One more agent you can take down, that is known as a glycopyrrolate. Glycopyrrolate. Okay, this is also used as a pre-anesthetic medication. The effect is same. In case of peptic ulcers, actually there are many safer and better drugs are available, so this is not that much use, but still it is there. Pyranezepine is selectively M1 cholinoblocker, so it decreases the acid secretion. And its another analog is there, that is telenezepine, pyranezepine, telenezepine. These all are the various analogs which are used. In case of bronchial asthma, very selectively acting drug is there, that is ipratropium bromide, analog of atropine, and this ipratropium is used in bronchial asthma to cause bronchodilation. So there are so many uses of this, and agents are there. Then in ophthalmology, in iriditis, that is when there is a inflammation in eye. Then keratitis, that is again keratin inflammation is there, and other inflammation diseases and trauma of eye, this is used so that they will reduce the secretions. Then diagnostic in the ophthalmology, atropine, homatropine, these are used, or cyclopentolate they are used. Why? Because they causes mydriasis, that is pupil size will increase. Because of increase in the pupil size, the doctor who has to examine the retina etc. can hits what's your instruments are there, can visualize the uh, retina and other portion very well. So atropine drops are given before that. In motion sickness, muscarinic receptor play important role. Motion sickness is what you might have heard about. People say that if they travel, they have vomiting or nausea senses. So this is called as a motion sickness. That whenever persons are traveling, because of traveling, they have a problem of vomiting. So this is called as a motion sickness. And in motion sickness, there is a problem that happens in chemoreceptor trigger zone. It is the area which is close to ear and brain, and that area is having many muscarinic receptor. If it is stimulated, then muscarinic receptors are also getting stimulated, and because of that, it initiate the vomiting sensation. It stimulate vomiting centers in medulla oblongata, and the person starts vomiting. So this is drug hyoscine hydrobromide. And there are many agents which are there. Avomine tablet, you people might have seen, it is having antihistaminic and anticholinergic action, or muscarinic blocking action. And therefore this avomine tablet, which is very popularly given, that is a promethazine, is a drug that is causing anticholinergic effect. Then muscarinic poison is there. uh, the poison because of the uh, this mushroom poisoning, rather we'll say. So atropine is the drug because mushroom is acting in organophosphate poisoning. Again atropine used as a drug. So you can see so many uses at many places. You will able to see these drugs, and these drugs have so many effects at various places. So what are various drugs? Atropine is a tertiary nitrogen. Good absorption, it penetrates blood-brain barrier. It is obtained from the plant that is known as Atropa belladonna. and therefore very commonly it is called as it is the tura plant, which is very widely present everywhere. So this Atropa bellatona is poisonous because it is having a very high amount of atropine. Now you can understand, if somebody consumes this datura or this Atropa belladonna, then what will be the signs and symptoms? So too much atropine or too much Atropa belladonna will cause the sign symptoms to what we call as a belladonna poisoning. Okay. So what are the effects? It is having smooth muscle relaxation and anti-secretory are the effects. It causes inhibition of smooth muscle tone and secretion, reduction in the peristalsis, constipation, paralytic ileus. Paralytic ileus means ileum will not having any kind of peristaltic. It will stop, and if it is stopped, then no food will go ahead, and there will be the problem. So there are the dose dependent adverse effect are there. The smallest dose normally is zero point 0.5 milligram, slight cardiac slowing, and slowly if it is there, then some dryness mouth, then inhibition of sweating. As dose increases, rapid heart rate, palpitation, marked dryness of mouth, dilatation of pupil, blurring of near vision, and at 10 milligram approximately, the person can go in coma, hallucinations, and delirium because of CNS effects. So we have seen the effects at for see the image you can see, that is for the ophthalmological test, or we call it as ophthalmoscopy. It is used. It is spasmolytic whenever there is a very severe colic pain, then it is used. It is anti-secretory during dental operation, tuberculosis, to block secretion in the upper and lower respiratory tract before surgery, in mushroom poisoning, organophosphate poisoning, during heart block, bradycardia, in cardiac resuscitation. It is used. Resuscitation means when there is arrhythmias are there, and asystole is there, that is systole is missing because of arrhythmia. You will study it in better way when you study cardiovascular system. Okay, so in that case this atropine is used. So what are the adverse effect you can see these are all signs, but I think because of what's your basic you understood, you must able to understand it. That means it is ophthalmological problem. Okay, this is a bladder problem, heart problem. What are the effect uses, you can enlist now. Okay, then what will be, this is what lips, and this what will be related to secretions. Okay, then this is what the bowel movement problem, brain activities. So these are all effects, and you guess these effects what these are. Okay, because we have seen acetylcholine, we have seen because of the effect, we have seen all the effect of atropine, and if these are the effect, if they are more, then this will be the side effects, or this will be the toxic effect can be there. So it is not used in narrow angle glaucoma. It is not used in a pyloric stenosis. Pyloric means you know about pyloric sphincter is there in stomach. So that pyloric sphincter, if it becomes hardened, that is called as a pyloric stenosis. Then prostatic hypertrophy, that is prostate gland hypertrophy or increase in the prostate gland size. In drivers, it is not recommended. I was telling about belladonna poisoning. So these are the effects. Same effect you can compare with the atropine, whatsoever figures we have seen. Okay, same thing is there. Dry mouth, difficulties in swallowing, talking, dilated pupil, photophobia, blurred vision, dry, flushed, and hot skin, difficulty in micturition. Micturition means urination. Then there will be constipation, hypotension, weak and rapid pulse, excitement, psychotic behavior, delirium, hallucination, etc. Now, what we will use for the treatment? Our treatment will be anticholinesterase drug, because we have blocked acetylcholine receptors. All muscarinic receptor we have blocked with the atropine because of the belladonna overdose, or what we can say, wrongly taking belladonna. Now we have to increase acetylcholine, so we'll be giving anticholinesterase drug, so that there will be increase in acetylcholine secretion. And since it is a reversible antagonism, because of higher concentration of acetylcholine, atropine will be displaced, and thus we can make the treatment of it. The other agents in this class are scopolamine. It is very popular drug for this motion sickness or travel related nausea vomiting. Is a tertiary nitrogen, penetrate blood brain barrier. Okay, so it is available as a transdermal packet, transdermal, that is localized type of there. So what it is done is that patch has to be put just behind ear, because the CTZ, chemoreceptor tripper zone, is very near. Particularly those who are traveling in flight, for them it is these patches are useful, because this patch has to be put, and this patch then will act for around this uh, uh, around 4 to 6 hours, and we can have several patches, because sometimes the long journeys, like US or other countries, they are a long one, 30-hour 48-hour journey, so you need drugs which is to be there and selectively going. So like that it is there. So this is a sign, it is showing motion sickness. This is what changes which are happening in the vestibules in the ear. If those who want to understand in basic better way, please read various vestibules and their role in balance, inner ear. Okay, study ear portion, vestibule and cochlea portion of the ears, their role in balancing and their role in motion sickness. Okay, please read this. And then this causes stimulation of CTZ, that is chemoreceptor trigger zone. Because of that, the drugs are showing action. Okay. So the other one is tropicamide. It is ophthalmic solution for just like atropine we have seen for eye examination. It causes dilatation of pupil, and the ophthalmoscope can visualize it in better way. Ipratropium, you can study it in more details when you will study bronchial asthma or respiratory system. So these are the agents which are acting, or this is one of the very very important agent in bronchial asthma and COPD. Then trihexyphenidyl is the agent that is used in Parkinsonism. This is also anticholinergic agent, but it crosses blood-brain barrier, and very very popular in Parkinsonism. We shall study it during Parkinsonism. Then next is about nicotine. We have already seen about nicotine. We have seen the effects of nicotine. And all these ganglionic blocker agents, I told you, they have very severe adverse effects. They are classified in the hypertension treatment. They are in the hypertensive or bronchial asthma treatment. But they are having so many adverse effects, and therefore we have made it in very red clear. That is, they are used rarely. They have severe adverse effect. Why there are severe adverse effect? We already informed, discussed this, that since these drugs are acting or blocking both ganglion, means sympathetic and parasympathetic, because ganglion is same in both cases. It is acetylcholinergic. Okay, so in both cases, these drugs are able to block sympathetic action and parasympathetic action, and therefore so many adverse effects can be seen, and therefore these drugs are of little use. All this neuromuscular we shall be studying later. As I told you, it is a separate chapter. So these all muscle relaxant and all this agent we shall be studying later. So this is how we finish various anticholinergic agents. Uh, there are some portion of anticholinergic agents, as I told you, they are